That is a question we have for our guest who is joining us now, Dr. Elaina George, by profession, a specialist for ear, nose, and throat. Joining us from Atlanta, Georgia. Dr. George, we very much appreciate your time. And many of the doctors surveyed were asked to provide anonymous comments about Obamacare. One observation is this from a physician, quoting now, "The system is broken and I am out of here as soon as I can. I'm tired of being used, abused, and lied to." Has anyone here awakened to the fact that we're always the last ones to be considered in the equation of change? Doctor, were doctors' protocols, was the practice of medicine adequately addressed in Obamacare?
Not at all. It was never about health. It was about control. And I think that doctors across the country are waking up, and patients are waking up to the fact that this is not what was promised, and what's happening is actually the opposite. Today, I lost a patient who couldn't afford to come and see me because her deductible is so high, she had to cancel her appointment. And another patient who can't have the proper procedures because his out-of-pocket cost sharing, the deductibles and co-insurance is so high. So there's a difference between carrying health insurance and actually being able to afford to see your doctor. That's what people are waking up to now.
And doctor, I'm going to give a personal note here. I come from a family of physicians, and I hear the same thing from family members who tell me that they're losing patients, which is so sad to hear. Do you believe the architects of Obamacare should be listening to these patients, should be listening more to the doctors, to be more in tune to maybe what pain they're going through?
Absolutely. I mean, I understand the thought behind it. You wanted to offer access to health care for as many Americans as you could possibly offer it. But the way that it went about, they never asked the doctors, they never asked the patients, they never asked the people on the front line what needed to be done to include people. And what they did is they doubled down on the most expensive aspects of healthcare, and they promised people they were going to get something for nothing. And it's not happening. As a matter of fact, it's going to become more expensive as it goes along.
So, Dr. George, it almost sounds as if we're engaged in a type of forensic medicine in terms of public policy. Looking back at this, was this by design to have a program that would so radically redistribute resources as to put us on a path toward single payer medicine like we see in Canada or the United Kingdom?
I think that's a very good analogy, a good interpretation. It's about centralizing healthcare. We are the last country of the developed world who are entering the socialized medicine system. That's what this Affordable Care Act is pushing us towards. And what that means is the government takes control. It's no longer the doctor and the patient who get to decide what constitutes healthcare. As a matter of fact, again, a personal anecdote, I'm getting letters, and doctors across the country are getting letters that what we recommend for our patients is not medically necessary, which means the government and the insurance companies are now practicing medicine. And this is really now becoming a two-tier system. Those who can afford to opt out do so, and those who can't are stuck in a system that denies them access and denies them care. That's the bottom line.
And doctor, I do appreciate your honesty and your candor, and I'm going to stick with that for a moment if we can. You obviously took the Hippocratic Oath. It's such an important thing to do. The trust that you have with your patients and the knowledge and the love and the bond that's established between doctor and patient. Just personally you, not only just being the doctor you are today, the physician that you have to be every single moment of the day, how has it affected you personally?
It's made me have to make a choice between practicing medicine the way I trained, using the Hippocratic Oath, and working against the interest of my patients. That's the stark reality for every doctor on the front line. It's about being able to offer services, being able to keep your doors open, pay your staff, and be able to practice medicine where the patient interest is first, not cost control. That's the choice, and I'm making my choice. I will not be a part of Obamacare. I can't be, because the Hippocratic Oath to me is sacrosanct. And so what I'm doing, and many independent doctors are doing, are now figuring out ways to work around the system. I offer barter for my practice. I offer sliding scale. I work with people who don't have insurance. And there's resources out there people don't know about. It's actually cheaper now to access healthcare if you don't use your insurance. A company called Liberty Health Share It's medical cost sharing. If you go to libertyoncall.org, you can actually buy a plan for a maximum of $199, pay $500 out of pocket, and get coverage for $1 million per occurrence per year, which trumps anything the insurance companies can come up with. And it's allowed under Obamacare. That's what doctors like myself have had to try to do, is to offer a parallel system which has the quality, which has choice, which has the doctor-patient relationship as the front most important thing. That's what patients need to be educated on. And that's what I'm doing now. I think every patient who walks into my office, if their insurance company blocks me from treating them, I let them know that, and we discuss how we can work around it.
So again, we're having a situation where good old-fashioned Yankee ingenuity is actually having to go around government because government has become an impediment to effective health care. That's essentially what you're saying, right, Doc?
That's exactly what I'm saying. And the take-home message is it's cheaper to access quality health care if you don't go through your insurance company or through the government insurance system. Talk to your doctor, find Association of American Physicians, AAPS, online.org, another resource where doctors across the country offer independent medical services to their patients that are cheaper and better than what they're going to get under Obamacare.
Dr. Elaina George, we thank you for your time and for your input. And to hear that, Olga, almost sounds like a Back to the Future moment where you've got a situation where even barter that physicians would take. It's interesting. We'll have to have Dr. George back in the days ahead.
And God bless her for what she's doing to help those patients in need with no insurance.
Too bad government doesn't remember the other admonition given to physicians: first, do no harm. But we're glad that physicians like Dr. Elaina George are there working on behalf of their patients. Your thoughts about Obamacare. Is it a good thing or a bad thing? What do you think is going to happen? Why don't you tweet us your comments at Newsmax TV, hashtag America's Forum. There's also newsmaxtv.com/comment, and don't forget Facebook.